We've all heard about germs most of our lives, but what are they? A germ is a microorganism which causes diseases. A disease is a condition of the living animal, plant body, or one of its parts that impairs normal functioning and is typically manifested by distinguishing signs and symptoms. Pneumonia is a life threatening disease caused by a germ called bacteria. Pneumonia is lung inflammation caused by bacterial or viral infections in which the air sacs fill with pus or may become solid. Some people may develop and already have symptoms of pneumonia, which may include fever, chills, wheezing, dehydration, sharp pain in the chest, and shortness of breath. There are 3 causes of pneumonia, which are community acquired, hospital acquired, and aspiration pneumonia. Community acquired pneumonia is a type of pneumonia that you can get in your day-to-day life around different types of individuals. Hospital acquired pneumonia is when a patient that is already immunocompromised and is staying in a long-term care facility or a hospital runs a higher risk of getting pneumonia. Aspiration pneumonia occurs when something that isn't air enters the lungs. Conditions like dementia, Parkinson's disease, and strokes can have very negative effects on the gag reflexes, which can increase the risks of choking. These conditions make people we care about more vulnerable to pneumonia. For adults in the United States, pneumonia is the most common admission to hospitals aside from mothers giving birth. Pneumonia is majority of the causes of sepsis and septic shock, causing 50% of the occurrences that may happen. Individuals 65 years or older are more at risk of getting pneumonia because as we age, our immune system may begin declining, making the elderly less likely to be able to fight off diseases, such as this one as well as many others. Chronic heart, kidney, spleen, or lung disease put the elderly greater at risk of getting pneumonia. The number of ER visits with pneumonia as the primary diagnosis in 2017 was 1.3 million people. Pneumonia is in the top 10 causes of death in the state of Indiana. Over the last century, the death rate from pneumonia has not improved, even though there are vaccines and antibiotics now available. In 2013 alone, pneumonia has costed nearly $9.5 billion in hospital stays. Even if the patient recovers, it could take 6 to 8 weeks until they are somewhat back to themselves and their normal routine. Out of 500,000 cases of pneumonia, 50,000 people die, and half of those deaths are individuals that are 65 years and older. Pneumonia can be prevented by things such as vaccines. Vaccines are the most significant ways that older individuals can better their odds. Getting pneumonia, hand washing, and the constant cleaning of high-touch surfaces can tremendously slow the chance of becoming in contact with the bacteria that can cause pneumonia and other diseases. Smoking on top of being an individual that is 65 years or older can deplete the chances of being able to fight off pneumonia. Making sure you're eating a well-balanced diet and managing things such as diabetes or other health issues can also aid in keeping the disease away. Sometimes prevention isn't good enough, and people do end up getting pneumonia. It can be treated case by case and depending on the severity of the disease. What is typically used to help in recovery of pneumonia is
Fever and
anti-pain reducers and also cough medicine. Hospital or intensive care unit stays may become a part of getting over the pneumonia. These stays may consist of oxygen therapy or breathing treatments, depending on how bad their breathing may be. And they may also consist in getting plenty of fluids, eating a well-balanced diet, and getting plenty of rest while you're in the hospital or in the care facility. Pneumonia can sometimes be treated after it's diagnosed by a physician. It is always best to be seen by a doctor as soon as these pneumonia symptoms occur. Even before pneumonia symptoms surface, they can, as well as other diseases, be prevented or caught before they further progress into something worse. Pneumonia can be prevented, especially for many of the elderly, by getting vaccines and frequently cleaning the high touch points of many surfaces. In conclusion, make sure you look after your elderly neighbors, your elderly parents, your elderly grandparents, and anyone else that is over the age of 65 because they're more at risk of pneumonia, and we want to make sure we can try to prevent this as much as possible.